Malvina Ibrahim is a patient education specialist at SeamlessMD, where she designs interactive digital care plans for patients, including bariatric surgery. Malvina has 2 Bachelors of Science degrees, the first in Health Studies and the second in Nutrition and Dietetics, and a Master's of Health Science and Nutrition and Communication from Ryerson University. As a registered dietitian, her passion lies in contributing to the development of effective, evidence-based communications that can help build healthy, supportive environments. Through her background in public health, she aims to make the healthy choice the easy choice so that a healthy lifestyle can be attainable and practical. When she's not working, Malvina loves to experience new foods and cultures, whether that involves cooking new foods or traveling to immerse herself in different cultures. She loves being a dietitian because it integrates her love for food and her desire to help others through culturally aware communication. Malvina, welcome to the show.
Thanks for having me. I'm excited to be here.
Excellent. We'd like to hear that.
Yeah, it's terrible when people come on and they come on.
They're just not excited to be on the show.
Not the norm that you're used to.
Definitely not. Usually we're dragging people onto the show, Malvina. So it's great to finally have someone who wants to be here.
I try not to make it too hard on Alan when he asked. I was like, okay.
Well, Malvina, today we're going to be talking about your work with bariatric surgery and our programs with SeamlessMD's digital patient engagement for bariatric surgery. Where we can kick it off, whenever we do a new implementation of any kind, we always interview patients about topics that are important to them. And so for bariatric surgery in particular, we're interviewing patients who have gone through bariatric surgery already to figure out what are unique topics or concerns that they value the most in a bariatric program. Are you able to speak to some of these unique topics and concerns that bariatric patients have told you about?
Yeah, so actually, interestingly enough, one of the more recent programs I did was bariatrics. And when I was speaking to one of the patients, what really stuck out with me is, at least the ones that had really successful weight loss journey, they said that they call the surgery one of the tools in their toolbox, which is true because bariatric surgery really isn't a magic pill. To weight loss, the patient has to be willing to put in all the work. They have to follow all the intensive pre and post surgery instructions. And it is actually very mentally tasking for patients, to the point where they even have site clearance before they can qualify for surgery to make sure the patient is actually mentally prepared. So I thought it was really interesting that that's what one of the patients brought up. And I guess it was a common theme as I kept talking to patients that, okay, yeah, this is very important to have this surgery, but you still need to be dedicated and put the work in.
Mm-hmm. While you were saying that, Malvina, kind of made me think that phrase should really be true, or we should think about that phrase for all kinds of surgery, even though usually I don't think we do. So when I think about something like even, let's say emergency heart surgery, where you weren't really planning to have it, it just kind of happened. But if you think about it, as we learned here at Seamless, even for the recovery side after a heart surgery, there's so many things a patient has to do in hospital when they go home to have the best health outcome. And I think the old way of looking at surgery was the surgery was the only tool in the toolbox. Surgery fixed you, and if you had a great surgery, you'll do well as a patient. And I think now we've realized that the patient journey is much larger than the surgery. And so I think that more people think about this concept of surgery as just a tool in the toolbox, not just for bariatrics, but honestly, really any surgery, or even if you think about taking medications. The medication itself is one tool in the toolbox of being a healthy, thriving human being. But I think too often we view these things like surgery or pills as the tool. Anyway, that was a really interesting way to frame it.
Yeah, no, and you're absolutely right. I think traditionally, especially when I speak to people like my grandparents, they think of, oh, if I get surgery, I'm going to come out and I'm going to feel fine and everything's going to be perfect. But in reality, you have to put the work in. Even something as simple as complying to those medications, you have to do that. It's one of the things that you continuously have to do to continue working on your lifestyle. And that's the best way to make sure a surgery is successful and stays successful.
Mm-hmm. Yeah, so there's a lot of need for education and keeping patients dedicated and adhering to the different protocols that we're asking them to follow. In your experience, Malvina, how is SeamlessMD and digital patient engagement, how does that help to address some of those topics?
Yeah, so to address these topics, we focus a lot on adult learning principles and behavior change theory, what our goal is to build that intrinsic motivation to help these patients stay dedicated to their journey. So, for example, in our program, we have an extensive education library that teaches the patient about each instruction provided by their surgery team, along with why it's important to complete each task. So, a crucial part of adult learning is that we as adults are actually goal and relevancy oriented. So, when we design a program, we have to explain why and how each of these tasks are important to the patient's end goal in order to help them build that intrinsic motivation.
And Melvina, on that topic, can you give like a common example, let's say bariatrics, of like what would be a typical instruction in a like that, let's say most paper instructions would have, and kind of how would you do it so that you're actually using the goal oriented kind of adult learning principles and all that?
Yeah, so a very common one for bariatric surgery is you need to stop taking birth control pills, or you have to change your method of birth control that you're used to. And something as simple as that, a patient might hear it and they might think, oh, it's not important. It's more important for me not to get pregnant. I'll continue using it. But we link them to our education library that goes into a lot more detail of why it's actually important to stop this birth control and why it's important to be aware that your birth control is actually not going to work after bariatric surgery. And that's why you need to stop it early on and find an alternative so you don't enter the risks of getting pregnant, because that's also something that you shouldn't be doing. I would say there's a specific time frame. I think it's about 24 months. Don't quote me on that. Sorry, 12 months.
Quoted.
No, take that part out. But there's a specific time frame that patients cannot get pregnant after bariatric surgery. So something like explaining that to the patient and telling them, yeah, okay, it's important not to get pregnant, but it's also important to understand why birth control pills are not going to help you in that goal.
And do you know if it's like why like that's often missing from traditional like aspects of patient education? Like, is it that people don't want to like put too many things like on papers? Is it that like we don't have enough time in like in the clinic visit to share all these like underlying reasons and context? Like what's your sense of like why we don't normally include like aspects of that?
A lot of it would be time. It does take a lot of time. And some patients don't like asking too many questions. They kind of feel like a burden, or they feel like, oh, maybe I should know this. I shouldn't be asking these questions. When in reality, unless you're in the healthcare world, even when you're in the healthcare world, a lot of people don't know the specific reasons of why you're saying the things you're saying. This is your expertise. It's not like 95% of the world's understanding of what you're doing. Yeah, I would say those two reasons are probably one of the two biggest ones that I could think of.
Gotcha. And it sounds like because there's all like so many different components in the patient journey and steps, one of the things that you do on the platform, you got to break them up, it sounds like, in some way.
Yeah, we try to break it into small little bite-sized pieces. That's what we like to call it, to make it easy for the patient to just open up the app. They know exactly, okay, stop birth control pills 1 month before surgery. There's always a learn more button. We start off with a small piece, and then you can learn more and understand why that's important. If you have any questions, where should I go? What's my next steps from here? It tries to help them know what to expect, along with helping them understand.
How does that work for like, because I know for bariatrics, there's a big dietary component, I think, in terms of the ways in which their diet changes, like before the surgery, and then definitely like the weeks after surgery, their diet changes again. Like that's a lot of information from what I've seen. How do you sort of break that up for a patient before and afterwards? Like, what does that usually look like?
So what's great about our platform is that it follows the patient in real time. So it knows when their surgery was, and knows when the patient got discharged. And that diet transition post-op is related to the surgery date and leaving the hospital, going home. So it follows up with them that, for example, a week after you leave the hospital, you have to transition your diet from liquids to starting pureed foods. The app will tell you exactly when that week is. It'll send you a reminder. It can even send you an email or text message or a push notification on your phone to be like, okay, now it's time to transition. Click here to learn how to puree foods, or some example recipes that will help you learn how to increase the protein in your pureed foods, for example.
Hmm.
So we try to guide them through not just the transition, but also what to eat, what foods to avoid, how to eat it, how to make it, example recipes. We try to support the patient as much as possible.
That's awesome. And in fact, I think like I remember we've heard that there's been some patients who actually keep using the Seamless app even like 2 or 3 years after their bariatric surgery because they still use it. Look at like the dietary information because that's just a lot more convenient for them than like carrying that 60-page booklet around. So I can definitely see how like long term, it's like I think unlike other maybe some surgeries that we do where I don't necessarily think a gallbladder surgery patient is looking at their Seamless information like 2 years after the gallbladder surgery, but I can see why for bariatrics there could still be some utility there.
Oh, of course. And the thing is with bariatrics, it is a lifelong journey. There is no way out really from like following that, I guess, lifetime lifestyle. So it is so convenient to have it on your phone if you're out, if you feel like you're forgetting something or you want to check a piece of information. It's so convenient.
Malvina, what I've heard from bariatric programs is that a good percentage of patients won't even make it to the bariatric surgery because they don't qualify for whatever reason. With the patients that we have on SeamlessMD going for bariatric surgery, I know you've built in a component beforehand to motivate patients so that they can qualify for surgery with different exercises and different milestones that they need to hit. Is there a certain methodology that you're using around preparing those kind of patients to qualify for bariatric surgery?
Yeah, so one of the biggest things I found when designing bariatric programs is the importance of including positive reinforcement. I think patients have, as you mentioned, a long list of tasks to complete just to even qualify for surgery. That doesn't include all the things they need to do pre-op or things they need to do while in the hospital when they go home. So it does take a long time to qualify. And as you said, people might end up giving up before qualifying. So we continuously try to ask questions to gauge the patient's progress. We can include that in different ways on the program, but a common one is including maybe a tracking survey for the patient. And based on where they are in the progress, in the journey, we'll send the patient positive messages when they've completed a task. And again, it's just an effort of building that intrinsic motivation. So we can even incorporate logic in the program. So if a patient isn't completing maybe a very crucial step and they can't move on past that, we can do two things at that point. Apart from the positive reinforcement, we can refer the patient back to their clinical team, their bariatric team, for additional support. Or if the team has clinical notifications, then we can notify the clinical team that, hey, this patient isn't completing these tasks. It might be time to reach out to them. And so there's a constant follow-up in providing the patient with the support that they need to help them even qualify for that surgery.
That's really cool. That's all I have to say. I mean, it's one of those weird things where it sounds like an obvious thing that should be something that's happening everywhere in different bariatric programs, but this is still pretty new for the industry.
Yeah, and to be fair, when I was building it, it's one of those things where I actually found it to be, I don't know how to exactly say this, but I felt like I was really making a positive impact on someone's individual life. And usually I don't feel that way because we work with surgical teams and we work with larger groups of people, and we don't talk to individual patients that often apart from when we're gauging how to build a program. But at this point, when you feel like, okay, I'm giving you positive reinforcement, it's going to one person specifically, and that one person might actually do better because of our program. It's very, you can help me with the word I'm looking for. It's
rewarding. Maybe?
Yes, very rewarding.
Yeah, definitely.
Well, but I remember like I forget which surgery type this was, but I remember there was a patient who sent feedback at the end of their experience on the platform, and the quote was something like, I realize this is like a digital platform. I realize it's not technically like a provider sending me that message in real time, that it's automated, it's digital, but it really made me feel like I was supported, because just like the look and feel and the interaction was just so frequent that even though it was digital, it was still very meaningful to them. Um, and I think maybe part of it is just that as you know, where society is now with technology, we're so used to interacting with digital experiences that you know, it's still better than not having that interaction in some ways. And also, I think one thing we do well is we do make it very human in some ways. Like we have, you know, photos of like the clinicians on the platform, and like the way that, you know, Mavina and your team designed the phrasing of the words and like the sentences is very like humanistic and very like conversational in many ways. So I'm sure that helps. I mean, when I look at the work that your team does, it doesn't feel like I'm reading off a robot, right? So I'm sure that helps too.
Yeah.
That's cool. I love hearing that.
And then the fact that the patient is getting just value all the time, whether it's a recipe based on exactly what they can eat in this week, or, you know, whatever it is actually pertaining to that individual. Josh mentioned that the program, especially for bariatric surgery, patients will continue to use years out into the future for recipes or just for, you know, different education. And I think it's the same case on the pre-op side, where, you know, the program might start even 5 months or 12 months before their actual surgery, just ramping them up to be qualified for surgery. Could you talk a little bit about how you've designed the program to be unique for bariatric surgery compared to some of these other service lines that you've worked on, in terms of, let's say, the pre-op component, on how long we actually have to build into that program on the front end?
Yeah, so you mentioned a very good point. So because there's a lot of pre-op instructions, and sometimes you do include that qualifying portion of the program without even talking about the surgery. It's possible for us to enroll patients on Seamless a lot earlier compared to other surgeries. So like you said, it can be up to 5 to 12 months before the surgery is even booked that the patient is on Seamless, and they're following, they follow through with the Seamless journey. Sorry, I'm going to rephrase that. Seamless follows them in their journey quite early on. But I think apart from that, we do have an enormous amount of tasks and reminders that are programmed. So as you mentioned before, one of the ones is stopping or changing your method of birth control. And they have a lot of pre-op appointments to, again, qualify for that. So we'll put in reminders for that as well, or prehab exercises. There's also some programs will include a pre-op diet, such as the OptiFast. So it is very crucial to have those patients follow along with these unique aspects of bariatrics, and we have to make sure to remember, we have to make sure to include these things in it. One of the biggest ones is actually joining a support group, because it's such a difficult and stressful time for them. We have constant reminders to not just join a support group, but go to your support group meetings. And actually, feedback I've gotten from patients is going to their support group is the best place to actually find out what other people have gone through, because it's the only people that can really relate to what you're going through. And they even found interesting like tips of how to be successful in their weight loss journey, things that maybe even clinicians might not know about.
Well, can you talk a bit also about what's unique about the bariatrics program in terms of when patients go home after surgery and they're tracking certain, you know, symptoms or issues? What are some of the unique things that bariatric patients would be tracking on Seamless?
Yeah, so we have a survey that'll check for, we call it like a head to toe check that comes up after you get discharged. And one of the unique symptoms that we provide recommendations for, it could be something like dumping syndrome or some specific nutrient deficiencies now that your digestive tract isn't in the same, I guess, orientation as it used to be, and different digestion issues. We also help them track the amount of protein and liquids they're consuming to avoid dehydration and muscle breakdown, along with checking for medication and vitamin supplementation compliance, because it's a lot for the patient to do right after they leave. That's apart from them actually feeling tired and not being, or maybe not feeling well and having pain. It's a lot to deal with. So we try to guide them through that and remind them to keep compliant with these things.
I've also learned that for bariatrics, people who've had that surgery have a higher risk of mood or anxiety challenges. I think there's higher risk of depression and anxiety, for example. I think for at least for some of our programs, they do more regularly have patients track, mood or anxiety, status, I guess, after the surgery. Is that something that you're seeing a lot as well with the bariatric programs you've been working with lately?
Yeah, I actually think as a patient education department, we are trying to make it a standard to always check for mental health after surgery, because it is mentally tasking. It's a lot of pressure. Some people live alone, they don't have support, etc. So yeah, even as part of our bariatric programs, we always check for mood and anxiety. And one of the biggest things, at least from patient feedback that I've gotten, is they love having that progress chart at the end that shows them how has their mood been since they started the program, how has their anxiety been, is it increasing or decreasing. And we obviously provide them with self-care tips that they can do at home, but if they feel like it's getting worse or suicidal thoughts or anything like that, we always refer them back to their clinical team, or if it's dire, call 911. Don't try to figure it out yourself. And I think that is a huge portion of our Seamless platform in general, because supporting patients is one thing, but you never really know what they're going through alone at home. So the best thing we can do is tell them where they can get help.
And getting,
sorry, go ahead, Alex.
I was just going to say, so getting help when the patient actually comes back to the clinical team, let's say for a follow-up appointment, the patient themselves are able to track their progress and see their mood scores and see their compliance and all that. But the clinical team also gets access to this information. And have you heard from some of our partners that they're able to access the information from patients for then a follow-up visit? They can review some of the answers with the patient. Has that ever happened? Or
Yeah. So yeah, as you mentioned, clinical teams have access to all of the patient's answers, and they can go back and track how they've been feeling. Actually, one of the programs I've built, the clinical team was very invested into mental health. So we actually programmed for them that if a patient said that their mood is, they're extremely depressed or they're extremely anxious, it probes them further to ask, do you want someone from our hospital's social services to contact you? And the clinical team will actually get notified about that, and they'll refer them to social services, and then social services will reach out to that specific patient and see what further support that they can provide on a personal, individualized level.
Wow.
Yeah.
It's such a different world than it used to be in healthcare. And it's really nice to see that a lot of our clinical partners are thinking about the patient experience like much more broadly than just here's what we're doing to you in the hospital. Now it's about, okay, here's how we're going to actually support you before, during, after this major life event. And then I think also, I mean, just maybe selfishly for an organization too, it kind of shows to the patient from, frankly, it's like marketing. It's, hey, like we actually care about you holistically. Like we care about supporting you at home. We care about, like you said, your mental health, your psychological health. Like we're actually going to keep track that and provide you extra services if you need that help. That's actually really that's really nice to see. It definitely wasn't like that, 10, 20 years ago. I mean, still not the most normal thing right now either, but we're certainly trying to help move that forward.
Yeah. Malvina, are you able to talk a bit about what some of the main themes have been from our patient feedback with bariatric surgery?
Yeah, so I think one of the more common things that I see is how much patient love, the reminders and the helpful hints that are on the program. Patients have said that it helps them stay on track. And a couple of patients actually mentioned that it helps them feel accountable in their weight loss journey. And I found that very interesting, because you'd assume a patient felt accountable in general. I don't know if that's the most appropriate thing to say, but knowing that there's something that helps remind you, oh, this is what I have to do, it's pretty amazing, because they have such a huge amount of pressure on them and they need to follow up with all these things. So helping patients stay on track feels rewarding. I think another major theme I saw come up is how thorough the program is and how it encompassed pretty much everything that a patient needs to know, including being able to look up a symptom and checking, hey, is this normal? Or how do I deal with this? A patient actually mentioned how they like that they can check the app for worrying symptoms before even calling their doctor. So I think it was cool to see that our program goes beyond just helping the individual patient. It can also help save the clinical team and physicians resources.
Like phone calls, for instance. Yeah.
Yeah, phone calls is a very big one for sure. And then I had another piece of feedback. I had a little story that came up. So a little endearing piece of feedback that I was reading about was the patient lived alone 2 hours away from the hospital, and she was thanking us for allowing her clinical team to be aware of her progress and know how well she is doing after surgery without having to physically be present. And I think this just generally shows the positives of digital patient engagement. It just empowers the patient to take care of themselves in the convenience of their own home while having the comfort of staying in contact with their clinical team and not feeling that disconnect that you might feel by living away, far away.
Yeah. And that even applies to things like taking a photo of the incision, for instance, if there's a problem that they may be experiencing around the actual incisional pain or something like that, they can communicate that without having to drive the 2 hours back to see their doctor, for instance.
Yeah, that's actually one of, I think, the more popular parts of our program is being able to check, is this an infection? Does this wound look normal?
Right. That's great. Josh, do you have anything else or?
No, that was fantastic, Malvina. And I think a lot of our bariatric listeners, of which I think we've counted them now. There's like maybe 2 million at this point.
Yeah, 2.5. Yeah.
Oh, wow, I underestimated.
It's growing. Strictly bariatric. Yeah, interested. That's great. Malvina, we've started something new on the podcast with anytime we have a guest, we're calling it the lightning round or fast 5 questions. So it's basically 5 questions that I'm going to ask you, and you can keep your answers as short as you'd like them to be, or you can expand on them if you'd like as well. I'll start with the first question. We're wondering if you have a favorite book or book you've gifted the most.
So my favorite book has a bit of a sentimental value to me. It's called The Thief Lord. It's a children's book, but it was the first book that I read that actually taught me how to use my imagination and engulf myself in the book. So it taught me to really love reading, and ever since then, it's kind of just been my all-time favorite.
That's awesome.
It's called The Thief Lord. Is that what you said?
Yeah.
Yeah.
Cool. I'm just like looking it up while you're talking.
Yeah. I figured. All right, second question. Who is a person, either dead or alive, who you'd love to meet?
Actually, my dad's parents. I never got to meet them, and my dad's mom passed away when he was young. We have a very tight-knit family, and I love hearing stories about how my parents grew up, and I just wish I could go back and get that experience through my dad.
Definitely.
I actually kind of feel bad when people don't answer with a more like personal answer like that, Alan.
Yeah. Honestly.
Yes. I'm actually surprised it's like no one else has, I think, brought up an answer like Malvina in the past.
No.
Yeah.
Most of the answers have been kind of off the cuff. They're just thinking of whoever's in their head or something like that.
That's awesome. Yeah.
Malvina, in your bio, you mentioned that you have a love for food. You've studied food. You've worked in food. I'm curious, what is your favorite food if you have one?
I have the most boring favorite food ever. It's potatoes, but I love them in all their forms.
You can make potatoes 100 different ways. So it's not that boring.
Wait, is that true?
You got French fries, you got mashed, you got baked potatoes, you got scallop. I could go on all day.
We'll be here for a while.
So Lavina, 2 questions for you. One is, what's the best potato, like the raw potato? Like if you had to pick the one best potato, what would that be?
I don't have a preference, and that is very mean of you to ask me for.
You don't discriminate against any potatoes.
Zero.
So what's your favorite, I guess, style of potatoes then, like in terms of cooking style?
Yeah, my favorite are roasted potatoes.
Roasted. There you go.
Nice and plain.
All right. Question number 4. Where is your favorite travel destination?
So it's not my favorite travel destination because I've never been there, but my lifelong dream is to go to South Africa and go to I just want to live in a safari for a few days and experience all the animals around me.
Yeah, that'd be cool.
So like just like go like lie in like the lion's den and just
Yeah.
just hang out kind of thing.
Yeah, don't go with a guide. Just try it yourself. Explore.
Honestly, my aunt lived in Tanzania, and
Yeah.
they kind of had that experience. And ever since
Cool.
then, why did I not visit them while they were there?
Oh wow.
Are you a big like zoo visitor? Like, are you into that kind of stuff locally here?
Yeah, like I try to focus more on like the ones that are conservation efforts. But yeah, I am a big animal lover. I love seeing animals and doing all that.
So you would be a tiger queen, like a tiger king.
Minus all like the killing.
Oh right.
Yeah. All that stuff aside. That's great. Last question that we have. This is a COVID-19 related question. What is one hobby or activity or skill that you've gotten into since the start of the pandemic?
I'm so torn about this question. So what I've actually done the most is cook new things. But I want my more interesting answer to be that I started painting.
Okay. What kind of painting?
I did the paint by numbers thing and it was so much fun.
Oh, nice.
But what is paint by numbers?
It's like they send you a canvas and then it's just like little boxes with numbers in them and they send you paint with the numbers and you just match the color.
Oh,
yeah.
Is this new or?
Well, so like the color by numbers has been around since the existence of numbers and colors. But this specific paint by numbers, I think I know exactly what you're talking about, Malvina. It's like you can actually use a real photo now, and they've turned that into a paint by numbers or something.
You want me to show it to you? I have it right here. It's not.
Yeah. So it's like you match the paint number with the spot on the canvas that has that number.
Oh.
So it's kind of like that, and I don't know if you can see.
Oh, that's cool. Yeah.
What is it like? What does it become after you color it all, or is that?
This is a flamingo.
Flamingo. Neat.
Oh, I see it now. Okay. Oh wow. How many different colors do you get?
You get about 30, at least.
Wow.
Oh wow.
That's pretty cool.
I forget.
Huh. For that one, is it like just a whole bunch of different shades of pink and red? And that's neat. Yeah.
Right. Yeah.
Because I guess you're coloring in the shadows and the highlights and everything on that.
Exactly.
Wow. Cool. Well, awesome. I mean, Malvina, we're looking at the time. We should probably wrap it up. But I did want to thank you for being on the podcast today, sharing your experience designing programs for bariatric surgery. I learned a lot. In fact, I didn't know like half of that stuff about our program. So that was really awesome for me to hear. And I'm sure our 2.5 million listeners at this point would get a lot of value out of the episode as well. If folks want to get in touch with you, Malvina, to learn more about the programs, where can we direct them?
Yeah, you can always email me at malvina@seamless.md. I think that's the best way to reach me. But thank you so much for having me. I had a great time. And I look forward to all your upcoming episodes.
All right. Thank you so much, Malvina. This was wonderful.
Thanks.